Hello, my name is Drake Washington, Senior Manager for Go Dental. I'm pleased to moderate today's session on transitioning to a residency program. I'm sure many of you have questions about making this transition and what the journey entails. Dental students have many questions about residency programs. Is a dental residency program for me? How do I apply? What is match? And we're confident that today's panel will answer most of these questions and give all of you a sense of what you should be doing now. I'd like to introduce our panelists today who have taken time from their busy schedules to talk about their experiences and provide some helpful tips and suggestions on how best to transition to a residency program. Joining us today, we have Dr. Rishi Kumar, who is an orthodontic resident at Harvard School of Dental Medicine, Dr. Patel, a current general practice resident at the Philadelphia Veterans Affairs Medical Center, and Dr. Stacy Robinson, also a current GPR dental resident at St. Francis Hospital and Medical Center in Hartford, Connecticut, who will be joining us later in the discussion. And Dr. Ryan Hyatt, a current pediatric dental resident at Children's Hospital, University of Nebraska Medical Center, who also serves as the ADEA Vice President for the Council of Students, Residents, and Fellows. Thank you, everyone, for joining us today.
Thank you, Greg.
Thank you.
So before we get into some questions, could each of you talk briefly about your background? Tell us your story. Why residency? And if each of you could state your name for our listeners before you speak, that would be great. Dr. Hyatt, let's start with you.
Yes, well, this is Ryan speaking, and I'm the first-year pediatric resident at Nebraska. Just a little bit about me. I was born in South Dakota originally and went to college in South Dakota. And I did my dental school at the University of Nebraska in Lincoln, Nebraska, and I'm currently doing pediatrics at Nebraska. What got me into residency? Well, education has kind of always been a passion in my life. I grew up teaching and coaching, and having a younger brother, I was constantly teaching him many things, at least I thought, and that kind of fit in with the pediatric scope of practice and incorporating education into dentistry. We incorporate education into all dental programs, but I thought it was specifically important in pediatrics. So it felt like it was a good fit for me to go into pediatrics for that reason.
Okay. Dr. Pol Pot.
Sure, this is Rishi Kumar here. A little bit of background. I was born in London, moved to Phoenix, Arizona when I was 4, and went to college in Connecticut. I went to dental school at the Arizona School of Dentistry and Oral Health. I was the second graduating class of that school. Afterwards, I did a GPR at Harvard's Cambridge Health Alliance, and then I practiced general dentistry back in Arizona at a community health center and applied to ortho, and I'm currently a third-year orthodontic resident in Boston at Harvard's program. In dental school, I was really exposed to a lot of different aspects of general dentistry, from root canals to restorations to bridges, and I really wanted to be good at one thing, and orthodontics fascinated me in terms of like the treatment planning aspects and the mechanics, and so I applied, and here I am right now.
Okay, all right. And Dr. Patel?
Hi, everyone. This is Jiten. I actually was also born in London as well and moved to Atlanta, Georgia when I was 10 years old. Been there most of my life now, and I went to dental school in the freezing SUNY at Buffalo. After I graduated, I am now working at the Philadelphia VA Hospital doing my general practice residency. And I live in Wilmington, Delaware right now with my wife. So what got me into residency? Well, I guess during my third year of dental school, towards the end of it, I started realizing the extent of my education in Buffalo. And I started realizing what kind of requirements I had to do, how many root canals, how many crowns, just how many extractions, everything that I would do by the time I finish. And I realized that, in general dentistry, I wanted to be better at everything. I wanted to do lots of different things, and I felt like I wasn't very comfortable doing all of those different things, only having done 3 or 4 root canals and 15 crowns. And I thought maybe in private practice, if I were to go and experience the higher demands for time, that maybe it would be a little bit more difficult to adapt, and I might find myself running into shortcuts or just finding myself in uncomfortable situations where I don't really have anybody to help, have anyone help me. So I thought residency would be a good idea because I would have more independence, but at the same time, I would also have specialized doctors that would be there to help, with anything I need. And I'd get a lot more broad experience, with endo, with perio, fixed, removable, operative. I mean, just everything. Just a lot more broad experience.
Okay, okay, very interesting stories. Did anyone go through Match? Can someone talk a little bit about that process, applying to Match, the waiting process, actually matching?
Yes, I actually went through Match. This is Jiten speaking again. Through general practice residency, the Match process, you submit your rankings in early January, and by the time everything's over, I believe you find out in the end of January. So the Match process is based on a ranking system, and if you have an interview at a program, then you have an opportunity to rank that program. So if you apply to 10 schools or 10 different residency programs and you have maybe 6 or 7 interviews, then you have the opportunity to rank all 6 or 7. You don't have to rank certain programs if you didn't like it, but you can rank as many as you'd like. And I actually like the Match process. I think it works in your favor. If you rank a program number 1, then even if they didn't rank you number 1, you still have a good shot depending on where they ranked you and if people they ranked didn't match there because they matched somewhere else. So I had a good experience with it, and it was a little bit stressful at times, wondering what was it going to be, but in the end everything worked out and I got my number 1 choice.
Okay, Dr. Patel, did you get your first choice?
Yes, I did.
Yes.
I got my first choice.
Okay. Anyone else?
This is Ryan Hayek speaking, and I also went through the Match process, and there's some things that were unclear for me right away. There's actually two things that you have to apply to. You have to apply to ADEA PASS, which is the postdoctoral application support service, and then also through that you apply to the Match program. So the PASS is an application that's similar. If you remember when you applied to dental school, they had the ADSES. It's similar to that. It's your basic information, letters of recommendations, and things like that, that you submit your application through that. And then certain programs are a part of the Match. And in pediatrics, a large majority of those advanced programs are involved with Match. So then you go through and, like Jiten was saying, you do your rank list over in Match. It starts a little bit earlier for pedo and some of the other specialty programs than it does for the GPR. I think it's like it opens in March maybe and goes till August or something like that. You'd have to look up the specifics on the ADEA website, but it is a little bit earlier. And so you do just like the dental school. You get all your stuff done, and then you hurry up to get all your information on the website and do all this, and then you sit around and you wait for about 3 or 4 months for interviews, and then you wait 3 or 4 months to find out where you match. So it's very similar to applying to dental school. The kind of, for all applications, you hurry up and get your stuff in, and then you just sit with a sick stomach for about 2 months, and then you wait.
Thank you, Dr. Hayek. Very interesting, very interesting. Great. So, I'm sure our listeners want to hear about future plans at this point in your careers. What are your career goals? Rishi, let's start with you.
Sure, this is Rishi again. I guess I've been fortunate to have great mentors along the way, from undergraduate to dental school and now in residency. And what like really surprised me, or what really fascinated me about my mentors are they're able to juggle a career in academia, research, and clinical practice. Like some people think you can just be a private practice or you just have to be a full-time researcher or in academics, but you can juggle three of those avenues, outlets really nicely. And I think for me that kind of suits my personality and my balance. And so I like to get involved with like patient care, so keep my hands wet in terms of orthodontic skills, improve like their current research going on right now in the field, and also more in terms of academia, in terms of like in the future get involved with running a program or dental schools, getting involved with that. So it's, I think I'm kind of like developing like a hybrid career in the future.
Okay. Dr. Hayek, Dr. Patel?
I'll go ahead. This is Ryan Hayek talking again. As far as my future career goals, as I mentioned earlier, dental education has kind of been a passion for me with my involvement in ADEA. And so similar to Rishi, integrating that, that you're not just, you don't have to be just one thing, that you can be a hybrid of things. And so my future goals involve, doing some part-time faculty work at a dental school, and then also for part-time practice.
Okay, Dr. Patel?
Okay, this is Jiten speaking. I actually feel pretty similar as Ryan as well, because I would initially, when I get out of my residency, I'm going to work into private practice. I'd like to start out as an associate just so I can get a good feel for how the business is run in practice management, understand insurance and how to manage your staff. So I'd like to spend a little bit of time as an associate, and then I'd like to take over a private practice and work in that for a few years. Once I feel like I've built up my skills and knowledge and everything, I would, long-term, my goal is to work as a clinical professor at a dental school.
Oh, okay, academics. Okay, wonderful, very interesting. Our listeners will find this information very useful in planning their next steps. And it seems that everyone has achieved so much here, and listening to everyone speak makes me think, would you have done something differently? Would anyone like to chime in on that? And just state your name for our listeners.
That's Ryan Hayek talking again. And one of the things that I've learned in dental school, you're kind of taught a specific way to do everything, and in some reality, in the real world, it's not as clear cut as it may be in dental school sometimes. So if I would have done something differently, I would have maybe done some more shadowing outside of the dental school of the different specialties, and not only to learn other ways of doing things, but also to expose myself to those specialties to see what I was truly interested in, because it's, especially when you're deciding a residency, you have to apply so early. It's tough to know when sometimes you're just getting into clinic and not even sure what they're all about. So I think any outside shadowing you can do is always good experience.
Great, great. Anyone else?
This is Rishi again. Yes, this is Rishi again. I think in dental school, people come in sometimes with like a narrow focus, like I just want to specialize in oral surgery, or I just want to do this. And they kind of like close out everything else. But I think in dental school, it's really important to have an open, broad mind, because you come back to that. When you specialize, you come back to the foundations you learned in dental school. You come back to occlusion, like that you learned in prosthodontist, which still apply to orthodontist. So I know I think I was not narrow-minded, but I was just like, oh, okay, I really want to be an orthodontist, so let me learn more about this. But it all comes together. It all integrates. When you do treatment planning, the foundations you learn in dental school pretty much guide you through your training and specialty. So it's really important to keep an eye out for everything.
Dr. Patel, would you like to add anything to that?
Well, in terms of the residency experience itself, I'm not sure of much else I would do differently. Things worked out very well. But in terms of preparing for the residency, I think there's one thing that I can think of. Most general practice residencies take place in a hospital, and therefore a lot of the patients you're going to see are immunocompromised and fairly medically complex. They're going to be on a lot of medications. They're going to have a lot of active problems. And I wish that during dental school I had spent more time focusing and learning a little bit more about that so that it would have better prepared me for the residency. I've learned a lot now that I'm in the residency itself, but it would have just been a nice thing to touch up on, and perhaps even spend a little bit more time at a hospital observing and shadowing some of the current residents just to learn a little bit there as well. And perhaps even a little bit of reading over the summer before residency started, that would help too. So, yeah.
Okay, interesting. Okay. Well, let's dive into some questions about the application process, dental resident interviews, and different changes you guys went through the process. I know these are very big topics, but let's just start with the application process. How did you organize and plan for the application process? Would anyone like to begin?
Sure. This is Rishi again. When I was first applying for general practice programs, general practice residencies, I first asked my faculty like what programs they recommended or which ones they thought were good in certain fields. And so first they gave me a list, and then I went to the ADEA website and also found different programs. And I also narrowed it down by location and geography where I want to be. And some programs are different. Some programs are very hospital-based, and some are clinic-based. So that's the difference between an AEGD versus a GPR. If you want to be hospital-based versus clinic-based. So that's one. That's one thing I had to decide early on. In terms of applying to orthodontics, it depends on where you want to practice. Depends on what you want to get out of it. I think all programs are created differently in terms of specialties. Some are more clinic-based, some are more research-based or theory-based, so it's important to see where you fit in terms of what you enjoy and what you want to get out of it and what you hope to contribute in the future. So I think it's really important to look at the programs independently once you decide on what field you want to pursue.
Okay. Anyone care to add anything?
It's Ryan Hyatt here again. And when I was looking for programs, I think Rishi hit it spot on. The faculty have a good general idea of what most of the programs are about, and how they do things there. So I think that's an excellent source, especially specifically if you're looking for a certain specialty. The faculty they've been through the process, and they went to a certain school, and they've got to experience other schools that way too. Also, another resource is if you're looking at it as a third year, talking to the fourth years who are in the process of doing the application right now. I think they're a good resource because they're kind of in the heat of it right now. And also, I used, just like Rishi, I kind of did a geographical mapping too, and I was just recently engaged, and so I wasn't going to go very far away from the Midwest. So it was important to me to be in a place where I was going to be happy and close to my fiance at the time. So I don't think that's a bad thing to do a geographical location as well. One of the recommendations I would have when you're deciding on schools, if you don't know much about a school and they're somewhat close to you, go visit. Call the director. They're usually more than welcome to let you come out and spend a day with their residents and see what it's about. As far as specifics, when you get into the application process, you have to send a lot of sometimes photos and sometimes letters to different areas. So kind of a very basic suggestion I have, and maybe a little too in-depth, but I took a manila envelope for each school that I was applying to, and on the ADEA website it's got kind of a list of what the schools are looking for. And so on the front of the envelope I would write 2x2 photo, one more letter of recommendation, everything they did. And when I got those, I would put it in the envelope and check it off the list. So I knew that I had everything for the school, and then I would, when I finally had them all checked off, I would send them to the school. So that's just kind of a suggestion.
Okay. Okay. And how are the interviews different than the interviews for dental school? Anyone care to chime in,
Jiten
Dr. Hyde?
speaking.
Mm-hmm.
This is Jiten speaking again. And I think the interviews, they were a little bit different, but not too much. I suppose in the content, it was a little bit more different because now it was more dental related. But I found that my interviews were fairly laid back, just like dental school. They weren't really grilling me on all kinds of different things. They weren't trying to trick me up or ask me crazy questions.
Okay.
Some of the common things that, especially in a residency, they'll ask you why a residency, and some other common questions. What are your strengths? What are your weaknesses? It's all fairly simple, and some things you can do is just the night before. I might try to come up with as many different questions that they could ask me, and I just write them down, write my response, and kind of just go over it. Don't memorize it because it's going to look very obvious on the day off. Just get the idea of what they might ask you, and so you have a nice smooth answer. And don't worry too much. Don't stress out or anything. It's really not that bad. Now this is a general practice residency, so I'm not sure about the specialty ones. But.
Right, and this is Ryan Hayek, and I would agree with Jiten on that. As far as my pediatric reviews, these people you're interviewing with are going to spend 1 to 3 years with you. So my advice would be just to let them know who you are. And there's some programs that you may not mesh with them, so you don't want to end up in a place where you're not going to be happy. So really being yourself, I think, is important, just to see how you're going to interact with these people who you're going to see every day, possibly for 1 to 3 years.
Okay. Okay. And in terms of clinical experience. Oh, I'm sorry.
Oh, I'm sorry. This is Rishi again.
Oh, okay.
Like Ryan and Jiten were saying, it's also important. Like at the same time, you're interviewing for the program, but they're also interviewing you, and you're also interviewing them. So, like Ryan said, it's really important to make sure it's a good match. And you can also while you're there, ask them questions about their program. Ask the residents what they feel about that program, and if it's something that you're interested in, or if it coincides with what they say, what they do on their website. So it's a good avenue to feel more about them and for them to understand more about you.
Okay, Dr. Pol Pot, thank you for that. Maybe you can start off with the next topic, which is clinical experience. What was the biggest difference between being in clinic as a dental student and being in clinic as a dental resident?
Good question. I think in dental school you're very scared and very timid the first time, like giving someone an injection and getting used to the mouth. So I think initially in dental school I was very kind of like shy, and everyone's nervous. This is a whole new time. You have great faculty like oversee you and guide you along the way. So as you progress and you're a senior in dental school, you get more confidence and you feel comfortable with what you're doing. When you start residency again, you're kind of the same level as well. You're kind of like unsure of what you're doing. But the good thing is you've had skill and exposure in dental school of what you're doing. I think the biggest difference though was in dental school you're mostly like taught lecture based of how things work, and everyone's along with you, like your cohort of classmates are all doing the same thing. In residency it's a little bit more, I don't want to say independent, but a little bit more self-taught learning in terms of like going out there and looking at the research and seeing what's new, what's out there, what you need to work on, what interests you, and at the same time going to different conferences and finding out what philosophies you like, what materials you want to use, what treatment approaches you want to apply. So I think it's more towards like everyone who's in residency wants to be there. Everyone's passionate about being there. They enjoy the field. They enjoy the profession. Now it's just in terms of like what you hope to gain from it.
Okay. All right. Great. Would anyone else like to chime in, add in?
Sure. This is Jiten again. I actually completely agree with what Rishi said, especially about the being a little timid during dental school. It definitely makes sense during third year when you enter clinic that there's a lot of things that you're not really used to. You're all of a sudden, working on a patient, you're doing things you've only done in your pre-clinic lab courses. I remember by the time I got to the end of my 4th year, I did feel comfortable, doing fairly simple things like operative and crowns and anterior teeth and premolar endos, stuff like that. But I remember when I entered the residency, it was that same feeling again of timidness, because you're doing a lot more complex procedures now, and you're kind of going back to almost the beginning. You have the foundation from dental school, which is great, so you really know some of the principles, but you're doing a lot of things that you've never done before. So whether that's placing an implant or doing a 2nd or 3rd molar endo, or crown lengthening surgery or any other types of surgeries, it's almost a little scary in the beginning again, because you're doing this, you've never done this before. And some other real big differences is the independence. When you're in dental school, you're going to be having multiple checks, and in residency, depending on which program you go to, depending on how your attendings are, you may have a lot of independence, and you may be able to do a lot of things start to finish without anyone checking. If you need help, you can go to them. And I feel like possibly the biggest thing was time. Again, in dental school, you're seeing 2 patients a day, 3-hour appointments each one. So you take your time doing your crown prep and, taking your impression, making a temporary. You might get 1 done in 3 hours. But when you get to residency, you have pretty much 60 minutes. Sometimes you can allot a little bit more, but you're doing a lot of patients. You're doing the same stuff but a lot quicker. So that's a little nervous as well in the beginning, but you get used to it. They start you off a little bit slowly, and you get real comfortable with it.
Thank you, Dr. Patel. Great. We've covered many topics today, and I think last but not least, I want to ask you guys, what advice do you have for dental students interested in an advanced dental education program? Anyone? Dr. Hayek?
Yeah, I'll start off. This is Ryan Hayek again. I guess my first bit of advice is going to be to anyone listening, whether you decide to go on to some sort of advanced training or you just go out into clinical practice. I think one of the things that that you can do right now is when you're seeing patients in clinic, sit down and think, what would I do if I didn't have a professor here at this point? When you have a question, start critically thinking about why you're doing certain things or the treatment you're doing. What would you do if you were in an office all by yourself and you were the dentist and you had to make those decisions? So I think that's a good way to start the transition into whatever you do after dental school right now. My second piece of advice is applying to programs is expensive. And we really hadn't touched on this space yet, and the 3 of us had talked about it a little bit. But it is expensive, so going to places, flying to places, staying in hotels, it adds up. So it never hurts to start saving. And I know some banks do have private loans just for like residency and relocation stuff. So it's all stuff you need to consider in your planning. And my last piece of advice is, if you're at that point and you can't really decide or there's something you're not super passionate about, it's totally okay. And Rishi could probably comment on this, that you don't need to apply right away. Some of the best applicants have been out in practice for 2 years and have a little bit better understanding of what some of the programs are about. So with that, I wish everyone the best of luck. Thanks for listening to us today. It's been a pleasure. So best of luck to all of you.
Dr. Pol Pot?
Yes, this is Rishi again. I agree with Ryan. Like, I think working for a year, like in either like in general or private practice or community health center, it actually like helps you in terms of like time management. You get a little bit more confidence with yourself, your skills, your clinical skills, your patient management skills, and I think it also puts perspective in terms of when you apply for residency. Like, you definitely cherish like being back in school again. You're like, okay, yes, I've saved up for the entire year, which also helps offset the loans and student debt we've had. And so it's also puts things into perspective. You're like, oh yeah, I remember, like, now I know how to do this. And I think it's just a great way to like appreciate the big picture overall in terms of how general dentistry and residency specialists come together and they work together in multidisciplinary treatment plans. And when you're working in private practice or any community health, you're working with other providers and other specialists, and you're kind of like a quarterback in terms of their treatment plans. And when you become the specialist, you're helping the general dentist and you're helping the patient formulate their entire care. So it's kind of nice to keep in mind of how things work together. But also, like, another tip I want to provide is when you're on the interview trail, when you're going to all these different places and you're traveling to all these different schools and visiting, you're going to see you're going to come across the same people over and over again because they're also interested in the same programs you are, and even the same specialty and the same programs. And so it's important to get to know them because you might even see them in your class when you get accepted, which happened to me too. So it's nice and refreshing, like when you go to different schools in different states. Maybe you might even share a room together to keep costs down, and then get to know each other. And then if you match at different programs, you have a colleague in another school, and you guys are in the same profession. So it's nice to bounce ideas back and forth and compare what they're doing in their programs because ultimately we're all in the same profession, and so it's nice to work together. With that, I just want to wish everyone the best of luck and good luck.
Thanks a lot, Dr. Pol Pot. And Dr. Patel, last words?
Yes, this is Jiten speaking. That's some great advice from Ryan and Rishi. And I'd like to just give some things that I thought was relevant to general practice residencies. Now, very specifically to general practice residencies, definitely not specialties, I know that some people may be concerned about grades if they didn't do so well in school. And I'd like to say that it's not just about grades to get into a residency for GPRs or AEGDs. Some residencies may put a heavy emphasis on it, but in general, program directors will take lots of different things into consideration. And one of the most important qualities is how well you work with others. Would you be able to get along with your co-residents, your attendings, your patients? And this is sometimes difficult to judge from an interview, which is why I heavily emphasize visiting a program so you can see how it is from your own eyes. And the program director and current residents can see how you are as well. Program directors, they look for well-rounded individuals. So it's a good idea to get involved in school. I'd recommend doing as much as possible to show your interest in dentistry. Go on outreach programs, do some externships, be involved intracurricularly. Those are some examples. Don't do it for the sake of putting it on your resume, but do it because you really are interested. And not all residencies are for everyone, which is again why it's really important to visit multiple programs, because you'll get to compare different programs and see which one you like the best. Some are well-rounded. Some focus more on specific things. Some give you lots of independence, whereas others have more strict supervision. You have to find out what you want and which program would be the best fit for you. If you can do this, then during the interview you can also explain how that particular program would be right for you. The last thing is something that I personally did when visiting different programs, was I brought a pen and paper with me, and I'd write down as much as I could about the program. How is the on-call? How many lectures per week are there? Do you wear scrubs, or is it business casual every day? How much experience you get with each discipline of dentistry? What are the rotations? Are there specialists? Are there post-grad programs there? Do you get implant experience? What's the patient population like, etc. So this will help when it comes time to compare all the different programs you visited. And what I did with that information was, in addition to just comparing it, I also went to a few different clinical instructors that that knew me pretty well and that were kind of like mentors to me. And I showed them all the information of my top choices, and I hid the name of the programs to prevent any bias. I thought this was a good idea because a clinical instructor who has done a residency and worked in private practice would be able to give you some good insight into things that might be a waste of time and things that would benefit you a lot in a program. And hopefully that clinical instructor would know you well enough to be able to help choose a program that's well suited for you. And that's what mine did. I'm very glad I did this because I ended up making the right decision and I'll never regret it once. So good luck to everyone. I hope everything works out the way you'd like, and thank you for giving time to listen to us today.
Hmm. You know, everyone has provided so much information today, and I'm confident that you know, dental students and graduates have a lot of information to move forward with from today's discussion. And I'd like to thank our panel, Dr. Patel, Dr. Provat, and Dr. Hayek. We do apologize that Dr. Robinson was not able to join us today, but we've learned a lot today. And to our audience, if you have any questions about today's panel discussion, please contact ADEA at ADEA_DEP@ADEA.org. We thank you for listening. Please enjoy the rest of the ADEA Online Career Fair. There are many presentations today. Be sure to visit booths and don't hesitate to contact us. We wish you all the best. Take care.